Okay, let's unpack that feeling of your sinuses just being under siege, the constant urge to sneeze.
Oh, yes.
Maybe even that general achy feeling that just won't quit.
Definitely.
If you're nodding along, whether it's like peak allergy season or you're just dealing with ongoing inflammation, you're probably looking for some ways to find relief.
And what's really interesting is how many people are exploring different avenues, looking at natural approaches alongside more conventional treatments.
Absolutely. And that's exactly what we're diving into today. You, our listener, sent in a fantastic collection of articles and research.
Really great stuff.
Covering everything from specific natural compounds to practical self-care tips. We've kind of zeroed in on two particularly compelling areas. The potential benefits of stinging nettle and quercetin.
Yeah. And we have quite a range of sources here. There's insights from Healthline, the Sinus and Allergy Wellness Clinic, the Jacksonville Sinus and Nasal Institute, plus some pretty in-depth scientific reviews from Pharmacognosy Reviews and PMC. Those cover our main compounds, but also related subjects like honey, probiotics, even vitamin C.
So our mission today is pretty simple. We want to extract the most fascinating and hopefully useful information about how stinging nettle and quercetin might help manage inflammation and those really irritating allergy symptoms.
Right. Give you the key takeaways.
Exactly. Without getting bogged down in, overly technical language or just overwhelming you with details. Ready to get started.
Definitely. Let's begin maybe with stinging nettle.
Stinging nettle, yeah. The name itself has a bit of a warning built in, doesn't it?
It really does.
But this plant, Urtica dioica, that's just the formal name. Good to know if you're looking at research. It has a surprisingly rich history. The Healthline article mentions it was used way back in ancient Egypt for things like arthritis.
Wow.
And apparently even Roman soldiers used to rub it on themselves, maybe to boost circulation or just, stay warm.
Talk about a plant with a story. That long history really hints at properties that people have recognized for centuries.
So what about the stinging part?
Ah, right. The stinging mechanism, as Healthline explains it, comes from these really fine hair-like structures on the leaves.
Okay.
The Latin root uro even means to burn, which tells you something. These tiny hairs inject a mix of chemicals, things like acetylcholine, histamine.
Ah, histamine. The allergy trigger.
Exactly. The very thing that causes itching and swelling, plus serotonin and other compounds. That's what leads to that temporary burning, itching redness if you brush against it.
Ouch. Okay. Definitely handle with care. But the good news, right, is that once it's processed.
Yes, exactly. Once stinging nettle is processed, whether it's in a supplement, dried for tea, freeze-dried, or cooked, it's generally safe to consume. And that's when we start looking at those potential health benefits.
Okay. So Healthline outlines 6 evidence-based benefits. First up, it's nutrient rich.
That's right. They mention it contains a lot of vitamins and minerals, though they don't list every single one, which honestly would be a bit much.
Probably wise. Good to know it offers more than just a prickly surprise, though.
It does. And one benefit that really ties into our discussion is its potential to help reduce inflammation.
Right.
Healthline notes it might be helpful for inflammatory conditions like arthritis, but they also quite rightly point out that more research is needed to really confirm those effects.
So promising, but not quite a slam dunk yet.
Precisely. It's not a definitive treatment on its own, based on current evidence.
Okay. Another point may be relevant for some listeners. Something about enlarged prostate symptoms. BPH.
Yes. Benign prostatic hyperplasia. Healthline mentions that stinging nettle could help with symptoms, particularly in men over 51. A few studies suggest it might ease discomfort with urination.
Which can be a big quality of life issue.
Definitely. Now, shifting to hay fever or allergic rhinitis, something so many people deal with.
Tell me about it.
Healthline mentions stinging nettle may help reduce these symptoms. However, and this is important, they also give a dose of realism. Some research suggests it might not be significantly more effective than a placebo.
Ooh.
Yeah. They emphasize we need more long-term studies in humans to really understand the impact on allergy symptoms. It highlights how early some of this research still is.
That's a really important reminder. It's easy to get excited about natural options, but the science, well, it takes time.
It does.
Now, something that caught my eye was the potential to help lower blood pressure.
Yes, that's another traditional use. Initial studies, mostly in animals and test tubes, suggest it might work by helping blood vessels relax and widen.
Oh.
through something called nitric oxide production, and it might have compounds that act like calcium channel blockers, which also ease the heart's workload.
Interesting mechanisms.
And here's the crucial point. Healthline stresses the effects on blood pressure in humans are still not entirely clear. So while those early findings are interesting, we need more human studies before we can say it's reliable for managing high blood pressure. Definitely not a substitute for prescribed medication.
Absolutely not. Good clarification. And finally, Healthline mentions it might help with blood sugar control.
Yes, studies in both humans and animals have shown a link to lower blood sugar levels.
Okay. And they briefly touch on other things too, like bleeding, liver health.
Right. Reduced bleeding, supporting liver health, possibly through antioxidant properties, acting as a natural diuretic, though that's mainly in animal studies, and even aiding wound and burn healing when used in creams. It sounds quite versatile.
It really does.
Yeah.
But we also need to talk downsides, right? The fresh nettle sting.
Definitely. As we discussed, fresh stinging nettle can cause those unpleasant skin reactions. Healthline lists rashes, bumps, hives, itchiness, all from those chemicals it injects.
And this seems critical. Interactions with medications.
Yes, very important. Healthline specifically calls out blood thinners, blood pressure meds, diuretics or water pills, diabetes medication, and lithium.
Wow, that's quite a list.
It is. They give a good example with diuretics. Since nettle might also have a diuretic effect, combining it with water pills could potentially lead to too much fluid loss, maybe dehydration.
Okay, so that's a definite talk to your doctor first situation.
Absolutely. If you're on any of those medications, you really need that conversation before even considering stinging nettle. Natural doesn't always mean zero risk with prescriptions.
Got it. So if someone is considering trying it after talking to their doctor, how do they actually use it?
Healthline says it's pretty adaptable. You can cook the leaves that deactivates the sting, use them in stews, soups.
Good.
Brew tea from dried leaves, apply creams or ointments with nettle extract, or take it in supplement form like capsule.
They mentioned specific doses used in studies?
They did 360 milligrams of root extract per day for enlarged prostate and 600 milligrams of freeze-dried leaves per day for allergies.
Okay.
But again, the main takeaway. Consult your healthcare provider before starting any new supplement and always follow the instructions on the product label.
Sound advice. Okay, so that's the somewhat intimidating but potentially beneficial stinging nettle. Let's switch gears to quercetin. Sounds a bit gentler.
Quercetin, yes, it does sound calmer. This compound, the fancy name is 3,3,3,4,5,000 pentahydroxyflavone.
Oh.
Yeah, basically tells scientists it's a specific type of flavonoid. The Pharmacognosy Reviews article describes it as a plant pigment and a really potent antioxidant flavonoid, a flavanol specifically.
And it's in common foods.
Very common. Onions, grapes, berries, cherries, broccoli, citrus fruits. Lots of healthy stuff.
And the name comes from oak forest.
Yeah, quercetum in Latin. But interestingly, our bodies can't make it. We have to get it from our diet.
Okay. And how well do we absorb it? The review mentioned something about solubility.
Right. It doesn't dissolve very well in hot water, apparently, but it's more soluble in alcohol and fats, or lipids.
So maybe eating it with some healthy fats could help.
Possibly. It might influence how easily our bodies absorb it from different sources. Something to keep in mind.
Now, the list of reported benefits in that Pharmacognosy Reviews article, it was, well, pretty long.
It really is impressive. They mention potential for cardiovascular protection, anti-cancer, anti-tumor effects, anti-ulcer, anti-allergy activity.
Anti-allergy, okay, relevant.
Antiviral, anti-inflammatory, key for us, anti-diabetic, gastroprotective, antihypertensive, immune system modulation, even anti-infective properties. Quite the resume.
Seriously. And a lot of that comes down to its antioxidant properties.
That seems to be the core mechanism. The review explains it can help neutralize those damaging free radicals, the unstable molecules linked to aging and disease.
Scavenging ROS, right?
Yeah.
Reactive oxygen species.
Exactly. Plus, it can activate our own antioxidant enzymes, bind to certain metals, help regenerate other antioxidants like vitamin E, and generally reduce oxidative stress.
So it tackles those free radicals in multiple ways.
It does. Though interestingly, they also note it can act as a pro-oxidant in certain situations. These compounds can be complex.
Right, it's not always simple. The article even listed conditions linked to free radicals. Stroke, Alzheimer's, depression, hypertension.
Atherosclerosis, asthma, kidney failure, arthritis, diabetes, cancer, inflammation, aging. It's a long list.
Really highlights why antioxidants like quercetin are getting so much attention.
Absolutely. And pharmacognosy reviews gives us a good idea of where to find it naturally. Onions are a big one, especially red and purple.
Okay.
Also broccoli, apples, cherries, berries, tea, both green and black, and even red wine.
So many of us are probably getting some already without even trying.
Likely, yeah. Which is great for a baseline.
Okay, let's talk specifics. What clinical effects did the review mention? Anything about bone health or cancer?
They suggested potential protection against osteoporosis and lung cancer, and more broadly that a higher intake of flavonoid-rich foods is linked to lower cardiovascular risk overall.
Makes sense. What about lungs? COPD?
Potential benefits there too, possibly by reducing lung inflammation. They cited a preclinical study, so not in humans yet, where increased quercetin levels significantly decreased lung inflammation in animal models.
Encouraging for future research. And what about catching colds? Respiratory infections?
That was interesting. The review mentioned a 12-week trial where 1,000 milligrams of quercetin per day reportedly reduced upper respiratory tract infection rates in middle-aged and older adults.
1,000 milligrams. That sounds like quite a bit, probably supplement level.
Likely, yes. It suggests a potential role in supporting the immune system, especially as we age.
Anything neuroprotective? Brain health?
They touched on that, benefits seen in rat brains when combined with fish oil, and potential protective effects against neurodegenerative diseases. Plus, its antioxidant nature suggests it might help prevent cancers triggered by oxidative stress.
Okay, so broad potential. What about specific results from human trials? Blood pressure again.
Yes, a few findings there. One study showed reduced systolic blood pressure, the top number, and also lower oxidized LDL, that bad cholesterol, in overweight people taking 150 milligrams a day for 5 weeks.
150 milligrams, okay.
Another study found it lowered ambulatory blood pressure in people with hypertension at 162 milligrams a day.
Pretty consistent dosage range there.
And even in women with type 2 diabetes, 500 milligrams a day was linked to reduced systolic blood pressure.
Higher dose there. And it wasn't just cardiovascular stuff, right? Something about polyps.
Yeah.
And kidney transplants.
Right. They noted effectiveness against adenomas. Those are polyps in people with a condition called familial adenomatous polyposis. That was using 20 milligrams of quercetin combined with curcumin.
Curcumin from turmeric, another anti-inflammatory.
Exactly. And that same low-dose combination showed a beneficial effect in kidney transplant recipients, too. Suggests quercetin might work well synergistically with other compounds.
Really highlights that potential for teamwork in the body. Now let's connect this to Susie Cohen's blog post you mentioned.
Yeah.
She had a specific take on quercetin and allergies, right?
She did. A really interesting perspective. She suggests that antihistamine medications might actually deplete quercetin levels.
Oh, really?
And, maybe more importantly, that quercetin itself helps stabilize mast cells.
Okay, mast cells.
Remind us. They're the cells that release histamine during an allergic reaction. Histamine causes all those fun symptoms like itching, sneezing, runny nose.
Got it. So if quercetin stabilizes them.
It could potentially reduce the amount of histamine released. Less histamine, fewer symptoms. She mentions her product uses dihydroquercetin, a form of it, along with vitamin C.
That mast cell link is really key for the allergy angle, isn't it?
It seems quite significant, yeah. Helping keep those mast cells calm could definitely play a role in lessening allergic reactions.
Okay, so we've looked closely at stinging nettle and quercetin. Let's try to weave this into the other resources, especially the ones focused directly on allergy management.
Sounds good.
The article from the Sinus and Allergy Wellness Clinic gives a clear definition of allergic rhinitis. Basically, inflammation affecting nasal passages, sinuses, ears, throat.
What most of us just call allergies, or hay fever, or pollinosis sometimes.
Right, and they distinguish seasonal versus perennial.
Do. Seasonal triggered by things like pollen, outdoor molds, think spring and fall allergies. Perennial is more year-round, often from indoor stuff like dust mites, pet dander, indoor molds.
And the symptoms are pretty universal, aren't they? Itching, sneezing, runny nose.
Postnasal drip, congestion, fatigue, just feeling generally unwell. Yeah, all too familiar for many.
Definitely. But the clinic's article then talks about herbal options. They suggest these might not just reduce symptoms, but maybe help prevent reactions and strengthen the body.
That's the idea. And they specifically highlight C. buckthorn hypophae rhamnoids.
C. buckthorn. Heard of that one? What's special about it?
Well, according to the clinic, it has an incredibly rich nutritional profile, over 190 nutrients and phytonutrients.
Oh, like what?
Organic acids, tannins, and notably quercetin, again.
Connection.
Plus vitamins A, E, C, B complex, and an antioxidant enzyme called superoxide dismutase, important for respiratory health.
So it packs a punch.
Seems so. They suggest it could help with allergic rhinitis, asthma, coughs, other breathing issues, and maybe even improve eye, mouth, and mucous membrane health.
Sounds like another powerful plant. But the clinic adds a word of caution.
A very important one. While herbs can be helpful, they stress consulting a healthcare professional or specialist before trying any new herbal treatment.
Why is that?
Because of dosages, potential contraindication situations where it might not be safe, and interactions, they wisely remind us herbs are medicine too.
Good point. Treat them with respect.
Absolutely. Professional guidance is always the best approach, especially if you have other conditions or take medications.
Okay. Now, for more direct relief from that stuffy nose, nasal irrigation. The Jacksonville Sinus and Nasal Institute article covered that.
Yes, a very practical technique. They provide clear instructions on how to properly flush out the nasal passages. It physically removes allergens, mucus, great for allergies or colds.
And the key is the solution, right? Getting the salt mix correct.
Exactly. An isotonic solution is best similar salt concentration to your body fluids, so it's comfortable.
What's the recipe, Ed?
1 quart of water, sterile, distilled, or boiled, then cooled. Very important to avoid infection.
Okay, crucial safety tip.
Mixed with 1 to 2 heaping teaspoons of pickling or canning salt. Not table salt because of additives.
Right, no iodine or anti-caking agents.
And they also recommend adding 1 to 2 heaping teaspoons of baking soda. Helps buffer it, makes it gentler.
And you mix it fresh daily.
Mix fresh every 24 hours. Start milder for kids, maybe less salt. And consistency helps. They suggest irrigating with about 100 milliliter twice a day.
Sounds like a simple drug-free way to get some symptom relief. The article also mentioned high oak pollen in Jacksonville during certain months.
Yeah, March through June. Just useful local context, highlighting a common seasonal trigger there.
Okay. Moving through the other sources, there was a PMC review on honey.
Yes, looking into honey as a potential remedy for allergic diseases. We didn't get the deep specifics from the excerpt, but it shows researchers are exploring even very traditional remedies.
Interesting. And then the PMC review on probiotics, that brought up the hygiene hypothesis.
Right, this idea that maybe our super clean environments mean less exposure to diverse microbes early on, potentially affecting immune development and contributing to allergies.
And it connects to gut bacteria.
Exactly. The review discusses how the gut microbiota, that community of microbes in our gut, might differ between people with and without allergies. Some studies found lower levels of beneficial bacteria like lactobacilli and bifidobacteria in kids in industrialized countries where allergies are common.
But the evidence isn't totally clear-cut.
It's not always consistent, no. Some studies don't find significant differences. It's complex.
Seems like the science is still evolving there. Did the review mention probiotics for preventing allergies?
It did highlight some studies suggesting a benefit in giving probiotics to infants, especially if the mother has allergies, for preventing atopic dermatitis, a type of eczema. Strains like Lactobacillus GG and E. coli were mentioned.
For treating existing eczema.
The effects seemed more specific to kids with IgE-mediated allergies.
Okay. What about for allergic rhinitis, the hay fever symptoms?
Again, mixed findings. Some studies showed promise with specific strains, like Lactobacillus paracassaceae 33 and Bifidobacterium longum BB536, helping reduce symptoms, but others using different strains didn't show significant effects.
So the specific type of probiotic seems really important.
It really does. And just to clarify the terms, probiotics are the live good bacteria, prebiotics are the food that helps them grow.
Got it. So probiotics and allergies may be helpful. Maybe it depends on the strain and the person. Still lots to learn.
Seems that way.
Okay, finally, the big review on vitamin C. Positioned as a vital antioxidant, right? For oxidative stress, inflammation, immune regulation.
Absolutely crucial. The review explains we humans have to get it from our diet because we lack the enzyme to make it ourselves, unlike most mammals.
And it's concentrated in the lungs.
Yes, high levels there. It plays so many roles. Direct and indirect free radical scavenging, acting as a cofactor for enzymes making collagen, serotonin,
Wow.
reducing inflammatory mediators, improving microcirculation, inhibiting cell death, augmenting bacterial defense. It's busy.
Very busy. What about for respiratory diseases specifically? Asthma? COPD?
In lab models of asthma, vitamin C showed promise preventing inflammatory cell buildup, relaxing airways, reducing responsiveness. For COPD, results were more varied, but maybe some improvement in antioxidant status.
And lung infections?
Some antibacterial effects seen in animal studies, but the picture in human pneumonia or COVID-19 is still unclear from that review.
And we should loop back to Susie Cohen's point, too. She mentioned vitamin C as a natural antihistamine.
She did. And also that antihistamine meds might lower vitamin C levels, so keeping levels up could be important when dealing with allergies.
Okay, wow. We've covered a lot of ground. Let's try to pull the threads together.
Good idea.
So, stinging nettle and quercetin, they both look interesting for managing inflammation and maybe allergy symptoms, but through different ways. Right.
Definitely. Nettle has that long history, potential benefits, but also those sting warnings and medication interactions to watch out for.
And quercetin, the potent antioxidant in lots of foods, seems to have broader potential benefits, including that mast cell stabilization angle for allergies.
Right. Then we have practical tools like nasal irrigation for direct symptom relief.
Super helpful.
The ongoing research into honey and probiotics, where things are still a bit murky but evolving.
Especially the probiotic strain specificity.
Exactly. And finally, vitamin C, just a fundamental antioxidant powerhouse with potential respiratory and allergy links too.
But the really, really key message that just keeps coming up.
Talk to your doctor.
Yes.
Yeah.
Across multiple sources. Consulting healthcare professionals, your doctor, an allergist, a specialist, before starting any new treatments, especially herbs or supplements, is just vital.
They can help figure out dosages, check for interactions with your current meds, and create a personalized plan. It's about safety and effectiveness.
Trying to self-treat, especially with complex stuff like allergies or if you have other health issues, it just seems risky.
It can lead to unintended consequences. Getting that professional guidance means you're making informed choices tailored specifically to you.
Totally agree. So as we wrap up this deep dive, it really makes you think, doesn't it?
How so?
Just given all these fascinating, sometimes surprising ways these natural compounds and practices interact with our bodies, what other incredible connections are out there? What potential benefits might we still be uncovering in this whole world of natural health?
That's a great thought. There's likely so much more to discover.
So we really encourage you, the listener, to keep exploring, keep asking questions. And hey, if you have insights or more questions, share them. Thanks for taking this deep dive with us today.